countries. Your support has been critical to our response. So my first task is to thank you for supporting this critical time, especially in Baja California Sur, where we have invested over $3 million to date on behalf of donors, that hundreds and hundreds of donors just like you. Most of these funds have been channeled through the efforts of the Community Alliance of Baja California Sur, which has members represented today, both from the board and from the recipients and membership. And I'm really grateful to them for taking the time out of their schedules, and want to acknowledge all the hard work that the Alianza has done so far to make Baja California Sur a safe and healthy place to be during COVID-19. As you'll hear today from our presenters, the emergency medical and food relief effort to support the families of Baja California Sur as they struggle with the financial and health impacts of COVID-19 has been unique and successful. It is also continuing today, which is why we wanted to give you a snapshot of how the state is doing. As you may have read in the news, Mexico is also opening back up for tourism and local economic activities as of June 15th. And as in the US, the number of cases is going up, including the announcement yesterday that the mayor of La Paz has tested positive for the virus. I'd like to play a short video, which is on behalf of the Alianza, to all of the donors that have joined us today, and then we'll turn it over to our presenters.
Our all-in-one marketing platform helps you market your business smarter with a marketing CRM.
I'm having some technical difficulties, so give me 1 second.
I'll just take this opportunity to introduce our panelists today. We have Elena Moreno from the Cancer Registry of Baja California Sur, Felipe Fernandez, who's the board chair of Los Cabos Children's Foundation, Lucia Frausto, who's the executive director of Como Vamos La Paz, Charlene Wenger from the East Cape Community Clinic in Los Barriles, Mackenzie Campbell, who is ICF's field representative and one of the volunteers from the Food Security Alliance and the local food relief effort in Todos Santos and Pescadero. And those are our presenters today. Thank you all for being with us.
Pues gracias por su despensa a todos los que donaron para nosotros, porque nos hace falta, ya que ahorita no contamos con el recurso.
Muchas gracias por esta despensa y queremos que nos sigan apoyando para poder salir adelante en esta crisis.
Por darnos el apoyo y más que nada estamos muy agradecidos de que sí se están preocupando por nosotros, de la gente.
Pues así lo poquito que tenemos en la casa pues rinde más y pues es una gran ayuda tanto como económica como para toda la familia. Y pues yo de mi parte pues como tengo niños pues sí es una gran ayuda. Pues esto dice para nosotros es mucho.
Sí, es de mucha ayuda la despensa ahorita porque no tenemos el trabajo, ¿verdad?
Muchas gracias.
Dios los bendiga.
Gracias por el apoyo.
Gracias.
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 Gracias, gracias por todo.
Wonderful. So that gives you just a little bit of a snapshot of some of the food deliveries that are going on the ground, and some of the faces that and families that you've been able to help with your donation. Right now, I'd like to turn it over to Elena Moreno, our first presenter, who's representing the Alianza Comunitaria Baja California Sur, and will describe the medical support our alliance has provided and give us some of the monitoring work that's been going on. Thank you, Elena, for being with us today.
Thank you, Anne. Good morning, everybody. The Alliance began with 4 women asking a question: what are we going to do about COVID? And we all began, it was Anne McEnany, myself, Lucia Frausto, and Marisa Comella from Los Cabos Children Foundation. And we began to do a survey within the medical community to find out how prepared people were. This was in February. And we found out that not very prepared at all. Personal protective equipment was non-existent and very difficult to come by. We were able to get a donation, a grant of approximately $60,000, and we began to buy supplies. It was extremely difficult because at that point, N95 masks, gloves, gowns, goggles were in short supply worldwide. Nevertheless, we took an order of the needs from the Secretary of Health, Red Cross, police departments, fire departments, first responders, and we were able to provide them with supplies. We thought our job was done, and then we realized that the major health institutions, ISTE, Seguro Social, they didn't have any supplies for their staff. And this came home with a snap in the head when 46 members of one hospital came down with COVID. So we began to raise funds and started doing a survey of what every single medical institution throughout the state needed, and we began to buy. At this point, we have come up with, we've spent over $420,000, and right now in pipeline, we're in the process of purchasing additional medical supplies to the tune of about $120,000 to have on hand as this next wave hits. We're also getting testing kits to help the state to amplify its ability to test, and also to help the empresario community to test employees, so that when people do come back to our state, they know that they're safe and secure. The health emergency was only part of the problem. We then began to realize that as people lost jobs, there was a huge need to feed people. And we decided that we would go through and move forward with an effort to feed. We found there were 96,000 families. That's like half of our whole state. We only have 800,000 people. And so we began to work on food. And getting food to people was a huge, huge effort, and doing it in a way that was transparent and accountable became an obsession with our organization, because we knew that we were going to be audited and there was just too much money on the table. We began to raise funds for this effort, and were very, very successful. In order to maintain transparency, we created a database. We have the support of an organization or a company in the United States called Fulcrum, which has an amazing application that we could have on a smartphone. So with every single delivery of food, we had our volunteers, they would register each person and do a small survey, do the georeferencing, and fulfill all of the criteria that we had to do in order to establish that every single food package that left our almacén, our warehouse, actually made it to a family. And that's been wildly successful, and we believe that this database, which is held by the Cancer Registry of Baja California Sur, will help us to understand the needs in the future. I think that at this point, we're watching very carefully to see what's happening with new cases as they seem to be increasing, and the need for appropriate testing is huge right now. So we're going to be focusing on filling our warehouses with supplies, so that the community, the medical community, continues to be protected. That continues to be our major focus, is making sure that all healthcare workers and first responders are protected. In the rest of the country, that hasn't been the case. Over 11,000 healthcare workers have been affected by COVID. We have not had that problem here. So we want to thank you so much for all of your support. And I'm going to turn over to Lucia Frausto from Como Vamos La Paz, who has valiantly taken responsibility for the gargantuan task of distributing food packages throughout the state. So thank you very much for your support, and thank you for joining us today.
Thank you, Elena. Thank you, all of you. I'm dealing a little bit with the sound. So just I want to try like this. Okay. This crisis has been for us a really opportunity. For the first time, we are working as community all together in the whole state, because we are here working in NGOs, organizations that we have been for years, but maybe in just focus in our topics or just focus in our region, in our small region. And this has been an opportunity to work as a community in the whole state. And the territory is super large, super big, our geographic territory. And with this networking that we have built, the distances are less. We have approached every rural community, people that we didn't know that they were in this really need of food, and this community feeling has been taken care in an harmonic way to the inhabitants. It's said by specialists and by research institutes that we have take care of the people so they are not feeling in anguish, or they are not feeling surrounded by violence. So this work has been really powerful. I want to just show you a little bit of the numbers. When we started this effort, we knew that 40,000 families would need in the whole state food. Little by little, we discovered that it was almost 100,000 families with this need. And the goal, we put it in, we established our goal, not with the capacity that we have as organizations. We put it with the need. And all this community effort has been bigger than the needs. So we have been sustainable during the time. At the very beginning also, we said 3 months, and we're here in the 4th month with this, and all this is also done by your support and the trust that you had. We trust in our capacity, and you trust in our efforts. So the baskets delivered until now are 115,000 baskets, and we have arrived to all the municipios, to all the territory now. This is the way that the georeference that Elena told is marked. So every time that we arrive, these are just spots, but if we could zoom them, it's thousands and thousands of spots of every family where we reach. The ones painted in yellow are the second deliveries, and we had been able to arrive with 3 deliveries to the most needed people. These are baskets delivered from the state government. The state government also trust in this effort and consider it really, really important, because they do not have, even if they are government, they do not have the power, and they cannot reach as much as we can reach. So together we're doing this, and this is the total delivery between the state government and the Alianza. It's almost 200 now, thousand. These are delivered by rural communities. So this has been a research of each family, and we go, and as you know, we deliver in their hands, in their house. So this is very detailed work in Los Planes, Argento, El Triunfo, and we have reached places and families that had never been reached without asking them a vote or something to give them food. So they're believing in this community work. This is in Los Cabos, and this is in Mulegé. Also in Mulegé, we're reaching ethnic groups. For example, our advice, where we arrived with them, we had to translate it in 3 different dialects, because there's people that do not speak even Spanish, and we're reaching them with this effort. This is in Comondú. So these are the detailed numbers. And I would love to share with you, if it's the moment, a video. Let me know if it's okay if I can.
Sure, go ahead, Lucia.
Yeah, okay.
Yeah.
Thank you. Let me go out. I have, yes, this is it. Let me see. Do you? I don't know if it's going to be listened. Can you listen to it? Are you listening?
No, can't listen, but we can read.
Okay. I'm sorry, I have problems with the sound, but it's really important to listen to it. So while another one speaks, I want to reach a speaker, okay?
Okay, so at this time, we'd love to hear from Felipe Fernandez, one of the board members for the Alianza Comunitaria, but also the board president for Los Cabos Children's Foundation. Thanks for being with us, Felipe.
Thank you, Anne. My pleasure. Hello, everyone. Good morning. And just first of all, I'd like to recognize Anne's, Elena's, and Lucia's, and Marisa's vision and timely conversation about how to move forward with this. And I'm very, very happy and proud to work and serve to the Baja California community with the ICF's leadership and really the passion that's being put into this effort. It's really, really moving in a sense. I'm going to talk a bit about the economics of the state and the way that businesses have been relating to this effort. As you all know, this is an alliance that was started from NGOs getting together and calling out to different sectors, the private sector as business within the business councils and the government to work collaboratively in achieving our common goal, which was and still is food safety for all the people in Baja and protective equipment and and whatever is needed in the health community to treat the pandemic going forward. So just to give you a few data points, the economic activities within the state are divided in proportion to their contribution to the state's GDP. It's around 4% for the primary economic activity, which is agriculture, mining, fishing. 28% it's for the secondary sector, which is basically construction, and 67% it's for the third sector, which is mostly commerce, services, and transport. So as you can see, we are incredibly dependent on services within the state, and the main businesses that provide to the GDP are hotels, restaurants, transportation businesses, and all of these economic units that cater to the tourists and visitors. As Lucia or maybe Elena mentioned, we have around 800,000 people living in the state, pretty much half and half male and female ratio. 86% of them live in urban areas and around 14% in rural areas. So it was definitely critical for us to involve businesses because they are a big part of the landscape that needs to be attended to, or their employees at least are. So having said that, the way that Baja California Sur's Community Alliance contributes and collaborates with businesses is by identifying which individuals were going to be laid off, trying to get a clear view of how many beneficiaries we would need to serve, and how the businesses could collaborate in us reaching these individuals. Obviously, the government has other set of beneficiaries within their different programs, but most of the people that were going to or are being hit by the contingency are people that are working at different levels throughout these businesses. So hotels closed pretty much early from the beginning. They've been closed for 2 to 3 months now. They just recently reopened on the 15th of June. Capacity of the hotels right now, there's 71 hotels out of 86 that are in the Hoteliers Association, and their capacity of serving right now, it's around 21%. By law, they cannot open for more than 40% of their capacity, and we're still seeing or trying to figure out what's going to happen with visitors coming over, not only for the generation of income for the business community and obviously their employees in general, but also to understand how the pandemic, considering the health aspect of it, is going to start shifting or moving so we can be better prepared. We do have a very good communication with the business councils. They congregate most of these businesses down here in Baja, and they have been extremely supportive of the effort. I always try to see businesses as being made up by persons and not just looking at them as business per se. It's really relevant to understand this because we all see the need and we are all hurting from it, especially business people. One such example is there's a lot of businesses that through their profits supported NGOs, which we're right now trying to see how that's going to play out in the next couple of months because they are not having any profits. They also considered at some point that this was going to be temporary, so they decided to not, lay off a really small amount of their workers and just reduce salaries to the vast majority of them. But 3 months after that, and with a 21% occupation rate, which permeates to pretty much the same activity for restaurants and other businesses down here, makes the situation very, very critical going forward. Unfortunately, we don't know what to expect going forward. Remember also that Baja California, and especially for the international travelers or the tourists that come visit us, they do so, there's pretty much 2 seasons, the November till May, which is made up for mostly international, or they're the bulk of the visitors. And then we have the June until October, which is pretty much made up for nationals, Mexican nationals traveling down here. Mexico, in general, as you may have read, it's in a very dire position regarding economic capacity. The federal government has not been supporting businesses in the way that the U.S. has, and there's clearly some sort of differences between the way going forward between these two sectors. So there's a lot of work to be done. I personally believe this is something that we will have to tackle for the next 6 to 8 months, and we will have to try to understand how that beneficiary list or number of people are we going to keep supporting, and we do need the help of business individuals and of the communities from international visitors that are set up in the state to be mindful of that. We do one of the main things that we want to avoid with the efforts that we're doing in the Alliance is social unrest. And as the video that Lucia was showing, there's priorities, and getting food to the table of the families is definitely one of them. People will be willing to risk their health to get food in the table for their kids and their family members. So I hope that paints a general idea of the economics of the state, and open for any questions you guys might have. Thank you very much.
Thank you, Felipe. We're going to have questions and answers a little bit later, and I want to make sure that we get to the rest of the presenters. So I want to introduce Mackenzie Campbell, who is the ICF field representative for the La Paz municipality and for Loreto. And she also has been a primary volunteer for the food security effort in Todos Santos and Pescadero. So thanks, Mackenzie, for being here today.
Thank you, Anne. So over the last 7 years, ICF has been leading, catalyzing, and investing in food security and food systems initiatives. And at this time, we recognize the importance of really critically analyzing and transforming our food landscapes. With this in mind, the ICF has been incubating the Baja California Sur Food Security Alliance over the last 7 years, and we're excited that it's now its own official nonprofit with the mission of encouraging, amplifying, maintaining collective action towards creation of food systems that are resilient, socially just, environmentally regenerative, and economically profitable. This vision closely aligns with the United Nations Sustainable Development Goals and the Zero Hunger Challenge. So looking at systems that are sustainable from production to consumption, supporting small-scale producers, eliminating food waste throughout the supply chain, accessing adequate food for all people throughout the year, and ending malnutrition. We've been taking a deep dive into understanding the current context of our agricultural and food landscape systems through an assessment We've been engaging with producers to understand the impact and response of COVID-19 on the sector and what challenges and opportunities we see to really incubate and nurture a regional food network that is resilient and connects producers directly to consumers. From the beginning of the pandemic, we engaged producers to cultivate what one farmer calls summer survival foods, which are beans, squash, sweet potatoes, corn, and directing these to food assistance groups and community kitchens, especially in urban areas in La Paz and Los Cabos. I'd like to highlight our grantee and active Food Security Alliance member, Raíz de Fondo. Since March, Raíz de Fondo has rescued 72,813 tons of unsellable produce. They've been engaging 262 volunteers and per week have been supporting families in need, up to 230 families throughout the La Paz municipality. And Red Turismo y Desarrollo Sustentable has been developing a program called Te Invito a Comer. They have identified 5 pilot restaurants that were at the brink of closing their doors to help support them to provide nutritious, hot meals every day for families and individuals that are most at risk of COVID. So that have an individual that's over 65, that have chronic diseases, have disabilities. They've created a training module in which they're providing biosecurity training, simple accounting, menu planning. Here you can see the menu for the rest of the month, and they're hoping to launch this program today. All of these projects have been supported, amplified by the Alianza Comunitaria. They've been actively involved, and I'd just like to mention the gratitude that we have towards the solidarity in a collective movement towards food security. Thank you.
Thanks, Mackenzie. And now I'd like to present Charlene Wenger from the East Cape Community Urgent Care Clinic in Los Barriles, who's been a long-time partner and grantee of the International Community Foundation and has been on the front lines of the COVID-19 response. Thanks, Char, for being with us today. You are on mute, Char.
Thank you. Thank you. I just wanted to thank all the panelists for coming. And I want to start with a letter of appreciation for my affiliation with ICF over the years. East Cape Health Center would not exist had it not been for the support that they've offered for our clinic. We now feel grateful to be affiliated with the Community Alliance to help us with the needed materials that we need for our clinic. We have a large functional medical dental clinic and pharmacy in Los Barriles. And when the global pandemic began to spread in the US, it was inevitable for it to come to the Baja. With the bordering states of California, Arizona, and Texas, where the COVID is real active right now, all the border towns are at such risk, and I understand that they're restricting travel into Mexico now in some parts of Arizona. As the numbers began to rise in Cabos San Lucas and La Paz, I tracked daily, I researched daily, and the numbers have gone up substantially just in the last week or two. And I assume this is community spread now. It's into our communities. The tourists are starting to come back and maybe carriers, we don't know. But with unrestricted travel, there's always that possibility. We have been donating part of our PPE to Cabos San Lucas Hospital. It's the EAMS number 26. We've been sending some PPE, some N95s that were donated through other means, and the face shields and the booties and gloves. I think they're very appreciative of any donations that come their way. In our town, we closed our borders of the beaches and to the entrance to the town. We were working with the delegado and encouraged him to limit the amount of travel coming from other areas like La Paz or Cabos and Lucas. They were very helpful, and we donated masks and gloves for all the screeners. We got on a funding drive to get COVID coverage for our clinics. We started with PPE wherever we could get it. It was very difficult in February and March, as you all know. The supplies were scarce. We were putting our fingers out to a lot of different areas and a lot of different providers, but we eventually got on a steady stream, and with Community Alliance participation, it's been just very helpful. When the COVID hit here in Baja, our clinic suffered greatly because the Canadians and expats and vacationers that usually come to our community during the April, May, June timeframe dropped. And so we hit a wall as far as our resources. We've been doing funding drives since that time, and we've been very successful to manage immediate funding to stay open for the time being, and then we're going to pace ourselves throughout the summer. We first donated, put up donations for isolation chambers as a clinic. We needed to be prepared for our paramedics to transport patients safely to the hospitals in Cabo or La Paz. Then we started with the PPE, and that became very successful. When we followed the COFAPRIS guidelines as far as sanitizing our clinic, we developed a different protocol so that we would be within the CDC and the COFAPRIS guidelines. We found now that our clinics and our pharmacies are environmentally safe. We've done training, and the staff has participated in a great way. We have very vulnerable staff, our dentists in particular, so we pay close attention to the sanitation of the dental rooms, especially with clients during oral hygiene. We set our clinic up so that we have distancing between the chairs in the clinic, and we've sanitized after each patient comes and goes. We have tape around our floors so that they distance themselves from one another, and we have followed all the guidelines so far and have been very successful not to have anybody suspicious in our clinic. We take everyone's temperature at the door. There's a notice at the front door that has a sign. We have a little bell that people will bring to enter the clinic. Their temperature is taken, and then they're reviewed. And we try to make our consultations as short as possible to provide the less amount of time in our clinic. Let's see, we have found that we were best suited to get our testing sites available. So we were lucky and fortunate to get testing for the clinic. So we have 2 different types of testing, and the doctor will certify each test that comes through. I want to just take a special thanks for all this opportunity to work in unison with other organizations. I'm actively helping with Rotary as a member over 20 years now. We have a food bank in La Ribera, and we have a food bank in Los Barriles, and we provide food to the community, and it's been a very successful endeavor. We provide the medical care for the folks in the community and at no charge for the children. ICF has been very special to us. Through the years, we've expanded. I think this is our 3rd expansion. and we've been able to provide a larger capacity for treating patients. We have a large emergency room. We have diagnostic equipment such as an X-ray and a full lab. So this is all designed to help sustain us through the revenue that we make through these services. And I want to just give my special thanks and admiration to ICF and Los Cabos Children and to the Food Alliance for all the strong work that you're doing. I think if we band together in unison, we can make a big difference in this lower Baja Sur. So thank you all for being there, and I hope someday you'll come to Barillas and stop in to meet us, and appreciate the work that we've done for the community. Thank you, Anne.
Thank you, Shar. And now we're going to open the door to you for our participants for questions. I invite you to put your questions on the chat. And while you're formulating those, I'll go ahead and answer some that have already come in. I wanted to talk a little bit about the northern part of the state. Our Community Alliance for Baja California Sur is active throughout the state. And as you may know, the northern part of the state is less populated, more rural, and smaller communities. The emergency food relief and medical efforts have been going on just as strongly in those communities as they have in the South, where the urban density requires a significant volunteer operational and logistical effort. The transportation, we've received support from the Army to transport goods north to the clinics, and also in Loreto especially, the food relief effort has been done in partnership with local supermarkets and local corner stores to be able to help local business people continue to build their economic situation. Other questions that have come in are related to the food security and just the sheer numbers of goods that we're purchasing through the Alliance to be able to provide food relief in these packages. 16 to 20 items in each despensa, in each food basket, are delivered door to door at this point. And those are being purchased in bulk to not overwhelm local suppliers and to make sure that there is still a food supply locally that people who do have economic resources are able to access. I don't know, Lucia, if you want to talk about the specific suppliers or just the process that you're using to identify how to purchase 115,000 of anything.
Yeah, well, in a part of all these partners, and well, the video is ready, Sergio has it for us. It's all these people that we do not see that it's working in this team. We are we're hundreds of people working, hundreds of people, including all of you that are supporting all this effort. Part of this team, it's team that is specialized in the groceries, and they buy for hotels in Cabo. So Pueblo Bonito is one of the hotels that put its team that makes all the supplies for the hotel chain. And so we're using their contacts, and we have also the review from Transparency. We have a support team of abogados, fiscalistas, that they review how we are making these shipments. So we have different prices from different suppliers, and it changes every 2-3 weeks, because it has been in the whole country an issue, the food. So at the beginning, there were a lot of them like raising prices just to because they had problems also. So we are all the time looking the best prices and who has the products. And then when they get here from ferry in boat and they arrive to the storage places, we have the army helping us. It's 3 groups of armies that are working with us. And every time that we discharge the trailers, we have to see if the products are okay and if they can come complete. So all this work is through a lot of people doing with it. And the local products, we have included local products, fresh local products that we have here. So the producers are in contact with us with by Mackenzie and the Alianza de Sustentabilidad Alimentaria, de Seguridad Alimentaria. So they let us know when they have products and they are not selling, and we buy them and we add these fresh products to the baskets. We have had donations of chicken, for example, and we have donations of eggs, and in thousands and thousands. So we have been delivering all this.
Lucia, there's a question that's coming in about the future possibilities of the Alliance continuing to distribute. And we've talked a lot about this at the board level. I'm wondering if anyone wants to share what our plans are for continuation of food distribution, if we have any projections of numbers that we plan to distribute. Elena mentioned that there's a lot of purchases in progress right now. Is there anything that you want to say about projections for the next few months?
The next few months, yes. Our first goal was for these 3 months. It was April, May, and June. That's what our first projection. Now we are projecting to continue July, August, September, at least, because we see that the economic issue is going to be still really, really an issue. We have now data. We have data that we have been taking a survey every time that we deliver the first time to the families. We have this survey about if they have a special illness, or if there's old people there, or if there are children in that family, the needs. We are making this survey more detailed survey, so we have more data as for example, just single mothers with kids, different issues that we can have. So after these next 3 months, there's going to be still families that will need the help, we know, but more detail. We are now in a transition process, because we were delivering in a very massive way with the army groups. The contagious of the COVID now, it's in its top in our state. So we do not want our volunteers. We have like 200 volunteers in the streets working with us to be in risk, and also risk the army. So we have to have less people now in the street. We are changing our distribution system for July, and come back with all our strength in August. In July, we are doing, we call it DHL. It's like delivery with single cars or pickups or trucks of private people, and like kind of a Uber. So we are doing it massively, but not with huge army trucks. We are going to do less of this. We're going to continue doing that, but less of this. And August and September, we know that we have to be there. We are also, as Alianza, prepared to react if, for example, a hurricane comes. And so we are already this network that we can just wake up in hours. We have done this work in days. We were organized. Now we know that in hours we can wake up all this effort to react and if a hurricane or something else comes to the community.
Thank you, Lucia. That is such a good point. I think the strength of the Alianza is that now we know we can mobilize this level of effort in any disaster or emergency situation that comes to the state, and that is a hugely powerful thing. The next set of questions, I think, will be directed to Felipe and Elena. They're primarily regarding employment and the diversification of employment. One of the volunteers from Loreto is asking if the Alianza is thinking at all about workforce development in other sectors, if we are thinking about how to get people back to work, and even with the comedores and the small groceries, how are we helping to reinvigorate the local economy?
Well, it's really complex situation, as I'm sure you're all aware. What I can say is that it definitely needs the involvement of the three sectors that are conforming the alliance: government, businesses, and NGOs. We are all being hit in so many directions by this. Businesses are bleeding money, so is the government, because they're not receiving any income from taxes they should be receiving. So it's really complicated, and personally, the only way I see this happening, it's to have a united front and bring debt into the government coffers, so we can see how we can subsidize. I don't know if it's a particular salary or an income, or if we need to plan out. Well, we need to do both. No, get the money in people's hands so they can get food, which is the first priority. But to make that shift in diversifying the economy, I don't see anything that we could readily have available without thinking about a 12-month plan. It's really complex, and I'm pretty sure this is going to be happening elsewhere. So we are thinking about this a lot, and whatever is the proposals that we have, we'll make sure to share them with you. And whatever you've seen working elsewhere, we would love to hear about it, because it's definitely a tough one to crack.
I'd like to add to that over the last few years, different NGOs and with Anne and part of the ICF team, we've been looking at economic diversity in Baja California Sur. One of the areas has been organic farming, which is now growing at the rate of about 10% a year, which is significant. We are the largest organic producers in all of Mexico, and I think that is a field that's wide open and that we can exploit. I think that right now, Baja California Sur is hurting tremendously because almost 80% of our economy is dependent directly or indirectly on tourism. And tourism is curtailed. So that means that 70 to 80% of our economy is virtually curtailed right now. In order to expand and grow, I think we need to look in other directions. The green economy and the blue economy are the right ways to go. I don't think that Baja California Sur can go into a brown economy again of mining or things of that sort. Our wealth, our true inherent wealth, comes from our natural beauty and from the environmental purity of our state. And we can develop new industries in fishing, in aquaculture, in trying to promote economic things that are directly related to our coastline and the Gulf of California. And then anything that has the environmental purity that we're known for. I think those are areas that we need to focus on and we need to enhance.
Thank you, Elena. We're just at an hour right now, so if I know people have to jump on other calls, I want to again thank all the panelists and everyone who joined us today, and thank you for your financial support. Thank you for your commitment and passion for Baja California Sur and for Mexico. We are so grateful for all the hundreds and hundreds of donors who contributed, and just know that we're continuing this work, and we will continue to update you and communicate the needs as they arise. Lucia, maybe you want to let the video go that you were proposing earlier, and if people can stay on to watch that, maybe we'll end with that. Thank you again.
That's great. Okay, gracias Sergio, ahí sí te lo pones. Gracias. Puedes ponerles CC para los subtítulos en inglés.
Sergio, no se escucha.
And while Sergio's getting that together, may I make a comment quickly?
Of course.
I just really want to thank all of your donors for the faith that they've had in the Alliance. Most of you don't know the organizations that can form the Alliance. You're there because of ICF, because of their reputation, and their reputation has really done a lot and been a lot for our success. They have a long track records to point to, and their bold leadership in so many initiatives and programs within our state has been amazing, really amazing. Many people think that you just donate and problems are solved, but it takes capacity, and ICF has spent a lot of time creating capacity here. When everybody thinks we have willpower and just wanting something makes it happen, but you have to have the will to manifest. And in this case, we've created a collective will. It started out with 4, then we created our board of 8 organizations, then it grew to 82 NGOs, 103 businesses, 5 levels of government. And now we have an amazing organization that's both sound horizontally, we extend throughout the state, and vertically. When we have a problem, we call the governor and the governor answers the phone and gets involved. When we need to know something about health, the Secretary of Health jumps in. We don't have to wait for a meeting. When we need something delivered, the military, the commander, the commandante of the Army or the Marines is right there asking Lucia, what can we do? How can we help? And the collective impacts of this will resonate for a very long time. And I just want to express my gratitude to all of you. It's been phenomenal. Thank you.
Thank you, Elena.
If I may say, in the Rotary, we have a term, it's called service above self. And I think that says it for all the organizations that go out there and do this day after day after day, even with some minor risk to our own health. So I agree. I thank ICF and all the initiatives that you put in my path.
Thank you,
Hay una situación de emergencia sanitaria.
Queremos trabajar exactamente por su propio riesgo, porque nosotros tenemos que aquí mantener.
Trabajo no le van a dar ahorita, entiendan eso. Somos inmunes a las enfermedades.
Lo que podemos es trabajar únicamente.
Esa es mi protección, no podemos exponerlos.
Tenemos que quedar en casa, bueno, está bien. Pero si igual, si no nos morimos, ni Dios nos mande del virus, nos vamos a morir de hambre. ¿Uno qué? Los hijos. Ellos no saben de pandemia, no saben de dinero, no saben de nada. Ellos nomás dicen, nada más quiero comer, tengo hambre.
Veo el caos de la gente, la preocupación, alguna gente nerviosa. Eso es lo que me preocupa, el caos que produce.
Buenas tardes. Venimos a ayudar por parte de una alianza comunitaria. Son ayudas en forma de despensa. No pertenecemos a ningún partido político. Somos ciudadanos interesados en apoyar en colaboración con el Ejército, Guardia Nacional y Marina.
Yo siento que la mejor manera de prepararme para los retos que vienen es justo lo que estamos haciendo, es estar en comunidad y afrontarlo en comunidad.
Y hemos estado trabajando en protocolos para cuidarnos a nosotros mismos como grupo y cuidar a todos los demás.
Cuando ya me di cuenta cuántas personas habían detrás de esto con la velocidad que se armó, eran muchas personas más de las que me imaginaba. Y nos empezaban a poner al día, ahora necesitamos voluntarios para el proyecto y vamos a empezar a juntar en Somos Médicos, pero también donaciones para armar despensas y ya están estudiando qué familias y cómo empezamos a hacerlo, pero cuesta mucho trabajo organizarlo. Entonces me di cuenta que se estaba tejiendo con una velocidad increíble algo atrás, como una red de hilos, donde se hace un tejido de apoyo, como una red de seguridad social.
¿A qué se dedica?
Me dedicaba.
A ver.
Era empleado de limpieza en el aeropuerto.
Pues ahorita lo vuelven a llamar, tengo fe.
Ojalá,
No,
primeramente sí. Dios, quedaron de llamarnos dentro de 2 meses. No, pues ahora sí que ni a dónde ir. Porque,
Bueno, sí es
pues,
cierto.
Ni a dónde ir porque no podemos salir.
Ya sé, cuídense
¿verdad?
mucho.
Y acá salimos,
Yo sé.
nos ponemos más.
Cuídense mucho, usted y su esposa, ¿ok?
Muchas gracias.
Hasta luego, gracias.
De hecho, con esta ayuda está ahorrando varias vueltas que a lo mejor serían improductivas, a lo mejor no consigue nada, ¿verdad? Y ya de esa manera, si anda propenso a recibir un contagio, ya no lo recibe. Ahora que si no tiene trabajo, pues con más grave.
Hola, buenos días. Estamos entregando despensa.
¿Y tú, Clarisa? ¿Por qué te aventaste el tiro a venir aquí?
Veía, bueno, en mis redes sociales sigo a gente de otros lados y así de que, sí, en Monterrey estamos juntando tanto y tanto para estas familias. Y yo así de que, ¿y aquí qué estamos haciendo? Así, yo qué puedo hacer, no sabía. Y en cuanto Sid me dijo, hey, estoy voluntario, ¿quieres entrarle? Y yo, fierro pariente.
Después de esto, vamos a cambiar todo.
El distanciamiento social es lo que más afecta, ¿no? El saber que no puedes.
Ya sé, un abrazo, así, quiero un abrazo.
Yo estoy listo para vivir solo toda mi vida, pero no estaba listo para quedarme en 4 paredes. Ya que terminamos todos esto, vamos a hacer un mega reve.
Cumbia, bachata, salsa, perreo intenso, banda.
Fierro, pariente.
Vamos a terminar cantando así desde José José y...
Gracias, señora. Trate de conservar adentro de su casa y nos vemos hasta el próximo mes.
Somos solidarios por naturaleza, por eso yo te protejo y tú me proteges. Por eso compartimos el aire que respiramos desde el mismo eje. Yo sé que el futuro es incierto.
Considero que comunidad y como humanidad debemos estar lo suficientemente despiertos para poder tomar un caso como el COVID como una línea de aprendizaje. Cada vez que veo estas cajas, no lo veo como alimento, lo veo como una luz de esperanza o de fe. No sé, como fe en la humanidad otra vez. Lo que entregas es como
ganas de seguir un poco, ¿no? Eso es lo que yo siento.
No, pues no queda más que agradecerles y ¿cómo se llama? Y ojalá que les alcance para todo el pueblo.
Gracias igualmente. Muchas gracias. Gracias muchachas, buenas tardes, gracias.
Ya al final es cuando una señora o un papá viene y ya pone el plato sobre la mesa. Se cumple esta meta de todo el proyecto y la intención de todos, ayudarnos entre todos.
Y que todo sea distinto, la verdad nunca se rinda, hasta las cosas lindas deberían ser más lindas, y si este es el final, encontraremos la belleza, quizás en realidad, ahora es cuando todo empieza.
Y gracias a esos señores que no aparecen más, no están recibiendo aplausos, gracias a esas personas que no se ven, pero sí se ven en los hechos. Un saludo para esas personas. Respeto. Creo que los mexicanos tenemos unidad, hay que llevarla a cabo.
Thank you for sharing that, Lucia. That is just beautiful.
Ay, qué bueno que se pudo ver. Thanks that well, finally we could share it. Thank you. And we're going to load it to our media, but it's not finished yet.
Well, thank you for sharing that with us today. And thank you to everyone who participated today. We will be sharing this recording by email, and feel free to circulate it and to share the good news and the upcoming challenges and the ongoing work with your networks and other friends and family that you know care about the places that we all love and live in. So thanks to all of you, the panelists who are doing the hard work on the front lines, and thanks to Leti and Sergio and Mackenzie for putting all of this together, and to Elena and the Alianza for allowing us the time to, with the board members and the participants who I know are so busy these days. We're so grateful, and above all, thank you so much to the donors who've been contributing to this effort. We will continue to communicate and to stay in touch and let you know how things are going. But again, so grateful, and we will be in touch soon.
Thank you so much.
Thank you.
Bye, everybody. Thank you so much.
Bye, everyone.